My name's Rosie. I'm chemotherapy specialist nurse from Velindre Cancer Centre in Cardiff. And we have piloted some video group clinics for our patients who are about to start a course of chemotherapy. Our main reason for wanting to do this was that prior to COVID, we used to undertake group clinics, which were obviously run face-to-face. Where we could have up to 10 patients at a time to be able to give them information about their treatment and to answer any specific questions that they may have. This ensured that they were better prepared for their treatment and had all their questions answered. Unfortunately, during COVID, we were then having to resort to doing this by individual phone calls to patients, which were obviously a lot more time consuming from the point of view of the nurse's time taken for each patient call. It could take between 45 minutes and an hour to go through everything that was required for the patients. So therefore, the video group clinics were an excellent idea to be able to group together between 4 and 6 patients we were aiming to do. And it also meant that they could invite a friend or a relative to join them to hear the information and to ask questions on their behalf, because it's always the case that 2 heads are better than 1. And if one person forgets the information, the other person hopefully will remember it. Yes, so we started off and we have, so far, we have run 6 sessions. So we're still really quite in the early days. We've had support from Redmore ELC for the first 4 sessions, which has been very, very helpful. And the big barriers that we found to actually getting on with the clinic were identifying a couple of key things, some of the resources required to do it. And they were most simply having an identified admin person to be able to recruit the patients and to book them into the clinic. Unlike some settings where you may be setting up a regular group and that once you've got the patients into the group and that they've worked their way through the technology and understood how to join a group, with us it's a fresh lot of patients every time. So therefore, every time we have to contact the patients, check that they've got the digital technology to join it. We also don't routinely at the moment record email addresses, which was a barrier. So therefore, that's something that we're actually requesting now, that all new patients registered to our system should be asked if they've got an email address, which would mean that rather than having to have an admin person phone the patient to identify if they have an email address to see if they are able to join the meeting, that we would be able to send the initial communication via an email and wait for a response, which the patients could then answer in their own time. Other practical considerations that I would definitely recommend that anybody looks at is making sure that you can identify a suitable room, because that was, again, proved to be a bit of a difficulty with room space in most healthcare settings being very difficult, so that you could have a room where you weren't going to be interrupted. You have something very simple like a do not disturb sign on the door, and make sure that everybody can conduct the session without interruption with the patients. The clinical team were very enthusiastic about taking this forward because they recognised the sheer volume of time it was taking to phone patients individually. But obviously they struggled a little bit with the concept of being able to run a group clinic virtually. Some of our staff, as well as the patients, didn't really have some of the digital confidence. So therefore training was vital to give them that confidence, and also running it through together with each other as a bit of a pilot run was also very helpful to be able to get that up and running. The wider team within the hospital trying to get the admin support team, the admin support allocated for it, has obviously proved quite a bit of negotiation. But having said that, those who then have joined in have been very, very enthusiastic and can see the benefit it has for the patients, because there's been some really positive feedback from patients who have attended as well. Yes, I mean, we've had obviously some informal feedback from patients at the time who have been very grateful and said thank you and how much they've appreciated it. And we are now beginning to collect some questionnaires, some feedback from them. And a lot of patients are feeding back to say that it was very, very helpful. In fact, I think it was 100% of patients who filled in the questionnaire so far have said it's enabled them to feel much more confident with managing their treatment. One of them quoted to say that it was very good to have that opportunity to ask questions and also to hear others' questions. And one of the key learning points somebody has said was to learn from what questions other people have asked, because they don't always necessarily think of everything to ask themselves. So they're learning from each other, which I think is the key benefit of this session as well. There's been varied feedback. I mean, some patients have fed back to say that they would definitely prefer it to be one-to-one, and some who fed back to say that they would still prefer face-to-face. But the vast majority of patients have actually said that they found it incredibly helpful, the way that it's been run at the moment. And I certainly envisage for the future, post-COVID, that we will have a requirement to run perhaps things in parallel, that we should be able to offer patients a choice. At the moment, we can't offer them the choice of face-to-face for the group consultations, but in the future, I'd like to be able to offer those the convenience of being able to do it virtually, so they don't have to leave their own homes, that they can get a relative to join them who perhaps lives quite a long way away. The furthest we've had somebody join us was someone whose son lived in London, was able to join, and he really very much appreciated that, because in fact his mother would not have been able to join the meeting if he hadn't, because he was supporting her with the technology. So that was really helpful. So I think running things in parallel will be a model that we want to take forward, but I certainly would like for the future to expand the clinics. At the moment, we're only running one, and the numbers that we got attending the first few sessions were only 2 or 3 at a time. But our last session, which we ran most recently, we actually had 6 patients attending, which was a really good number. And I think from our perspective was probably the maximum really that we'd want to do in order to be able to address everybody's individual questions. The key things I would suggest that if people are considering doing the video group clinics is to clearly identify your group that you would are targeting and what benefit it's going to be to them. Trying to ensure that you have processes in place to recruit patients to the clinic which are smooth, having that key admin support and facilitator on the day, they're absolutely vital. And some of the practical things I would also say is sussing out your room that you're going to do things in. The other key thing that would actually be really helpful is to identify somebody who is able to be the contact person for patients who are having difficulty maybe joining on the day. And that's something we've struggled with a little bit, is that patients have agreed to join the clinic, telling us that they are not quite, competent, or they're a little bit unsure about their confidence in joining a group. And then on the day, we've been waiting for people to join and being uncertain as to whether or not they're trying to join or they're unable to join. And then you've got 3 or 4 other people hanging around and waiting. So to have somebody to contact those patients has been very helpful. And there's been a couple of occasions when we've managed to talk patients through into joining the clinic, or we've been able to reassure them and tell them not to worry, that if they are unable to join, that one of us will phone them later and contact them later to catch up with the information that they would have missed out on.